My name is Aziz, and today I'll be teaching my fellow research assistants how to use a blood pressure machine that we have here. So this is the Atrium G56H, and we'll have the blood pressure machine in the corner here. As you can see, it's plugged into the power cord right here, and on the left side, you just take it out whenever you're ready to use it. And then it's on wheels, so you can just move it easily to the side of the patient. And then on the back here we have the various arm cuffs, and they're each labeled with the sizes from small, medium, large, and extra large. So if this is a patient that has been here for a visit before, on the instruction sheet you can use it as a reference to which size has been used before. If not, you could try various ones that are comfortable for the patient. And if you do need to switch them, there are these on the ends of the ones that are not in use, and you could easily take them off and put them back on. So once you've found the size you want to use, you'll just set this up to the side. And if the patient is wearing thick clothing or anything that might interfere with the testing, you'll want to ask them to either take it off or roll up their sleeve. And this, probably have you put it down because we're going to put it up here.
Okay.
If whatever they're wearing is thin enough, you can just have them pull it down. You don't want it scrunched up over where you're going to be putting the cuff. So if you rest your arm here for now. Okay, you'll just put it around, and here there's an arrow for the artery. That's going to be on the inside of the arm right about here. So you'll just line that up and ensure that it's not too tight when you put it on. You want to make sure you can fit at least 2 fingers in. You don't want it to be too loose or too tight. Just tighten up a little bit. Make sure the arrow is where it needs to be. And let's see, you fit 2 fingers in, you know it's not too tight.
The arm rest that this way.
Yes. So then you want to have their arm rest like this, and then have them their palm facing up, and then you can make a fist. And to operate the machine, you'll just want to press the on button once.
Release. Yeah.
And then we have various buttons here. The start button will start the countdown from 5 minutes. So press start. And then the patient will just rest for 5 minutes. During that time, you don't want them to be stressed or having talking on the phone or any conversation that might affect their blood pressure. They really want to take the 5 minutes to come to a resting state. So right here we have magazines in the atrium if they'd like to read that, or oftentimes some patients would like to review their materials before they take a quiz, or even use their phone. But no talking too much or anything that might aggravate their blood pressure. So also on the machine we have the temperature, which will record on the sheet. And then we also have this button here. Once the blood pressure reading has completed 3 times, we have the average. It says average, first, second, and third. So basically how this works is after 5 minutes we'll take 1 blood pressure reading, and then in between there will be a 1-minute interval for a rest period. Then I'll take a second reading, then another 1-minute interval, then the third reading. After that, the screen will show you an average of the 3 readings. Then you press this button to go through the rest of the reading. So first it will show average, you press it once, then it will show the first reading, press it again, second reading, press it a third time, it'll show the third. So you'll want to take a picture of each of the readings after you complete the handout sheet, which is right here. So on this sheet we have patient's participant ID. You put your research assistant's name, today's date, and the time. Then ask the question if they've smoked any cigarettes or tobacco products in the last 3 days. So that's a question you want to ask the patient. And also some patients may smoke marijuana using nicotine wraps, and a lot of times you might ask them if they smoke any tobacco products in the past 3 days, they might say no. So if you know the patient's history that they do smoke marijuana, or if it's their first time seeing them, you might want to ask, because the nicotine wrap might also affect their blood pressure. Then also we have the room temperature reading, which is the thermometer is on the blood pressure machine, and then you have what machine you're using here. Then you'll indicate which arm that you place the cuff on, right or left, and then the cuff size. So as I said before, in the dark blue folder, this is where it'll be, and it's good to reference this when selecting what blood pressure cuff size to use. And then here we have where you'll record the results of the blood pressure. The first screen will show you the average, so you put the systolic, which is the top number, diastolic, the bottom number, and then the pulse. So you'll record each of those, and then lastly it asks you a question. If their blood pressure is too high, you want to mark it as indicated here. If not, press no, or select no. And as it says, you'll want to let Dr. Wen know if it is high, so then we can refer them to their primary care physician or OBGYN. So then after you're done completing that, you can take it off and you can put it here. And then with the iPad, you want to take one picture first of this filled out completely with the average. Then you'll take 3 more pictures of the first, second, and third readings.
Also, we have mentioned we have instructions there.
Oh yes. And this will always be clipped to here. This shows you instructions on how to use the blood pressure machine if you ever are in doubt or forgot any particular step. So and on the back side. So when the blood pressure reading is complete, and before you begin writing down the results, you want to take the blood pressure cuff off. So.
Oh, not that finish.
Oh.
We need to record the reading.
Oh, okay.
Yes. We have 26 seconds left, so we do everything.
Okay.
See, can you grab an iPad?
Take a picture.
Tell them what's happened now.
Okay. So once the timer has reached completion, you'll see that the pressure is starting to increase and the blood pressure reading is starting. And you can see it's blinking first here, so that's how you know that this is the first time that it's reading. And another thing is the mode here. It should always be on average, but there's also single use, and you'll want to make sure it's on average. But here you could see for about a couple seconds it showed the first reading, and now it's starting to count down for the second rest period.
Put information.
Okay.
$999. Talk.
Okay, so I'm writing today's date, 4/22/19. Time, it's about 4 o'clock, I believe. So in the past 3 days, have you smoked any cigarettes or any tobacco products?
No.
Okay. And do you smoke marijuana with wraps at all, or no?
No.
Okay. Okay, now I'm recording the room temperature, which is 72.5 degrees Fahrenheit. Machine 1 is on the right upper arm and medium risk, or medium arm cuff. Okay, now it's beginning the third reading. Okay. Now the blood pressure readings are all complete. Before you record your results, you want to take the wrist cuff off and make sure that the patient's okay. So, are you okay? Is your arm hurt at all? Or?
No.
Okay, great. And you can put this back in the back of the blood pressure machine and then begin to record the results. So, as you can see in the first screen, it shows systolic blood pressure, diastolic, the beats per minute, which is a heart rate or pulse, and then it shows you which reading. So this is the average of the 3 readings. Okay, and then you'll press this button here, which says deflation, and then average first, second, third once, and then it goes to the first reading. So record that one. And then do the same process for the next 2 readings. Okay. Then you'll want to check to see if any of the blood pressure readings meet the criteria on the bottom, which would be at minimum blood pressure higher than 130, or systolic over 130, or diastolic over 80. And as you can see, none of these meet that criteria, so I can put no. And then place this on this clipboard here. And then using the iPad, we'll take 4 pictures. Okay. And then once that's done, you want to make sure that your pictures look good and clear, that you can read both the machine as well as your paper. As long as all of them are good, then you can turn the iPad off. And to turn this off, you'll just press the green on-off button one more time, and it's off. Then you'll want to put your patient's test results in the dark blue folder whenever you get a chance, and then place this back on the charger in the corner.
Say something.
Alright, so that's how you measure a patient's blood pressure, and if you have any questions, you can ask myself if you see me or Dr. Wen.
Great.